Okay, so here we are in the ASU Student Success Lab, and we have gotten out our resident skeleton who lives literally in a little closet here. So we pulled her out of the closet, and I want to go over some of the bones that constitute the bony box that we recognize as the housing for the respiratory apparatus. So you can see here the sternum. We have the manubrium sterni, the corpus sterni, the ensiporn process, also known as the xiphoid clavicles, humerus, etc. So the dark portion here is representing the cartilaginous portion of the rib, or it also can be called the chondral portion. We have the osseous portion here in the actual bones. I wanted to just identify, we have 7 true ribs, 1, 2, 3, 4, 5, 6, 7. They constitute the true ribs. These bottom 3 that are only attached to the sternum through the cartilage are the indirect ribs. And then behind, you can see that there are 2 ribs which are not attached to anything. Those are called the floating ribs, or sometimes the vertebral ribs, because that's the point of their attachment. So I wanted to talk a little bit about the muscles. It's a little hard to visualize or get the concept of the internal and external intercostals. So, okay, so here what we have done is we have put this film that has red lines on it to represent the internal intercostals. And so these muscles are going to go between the ribs. That's why they're called intercostals. And these are going to have their origin on the bottom of the rib above and on the insertion on the top of the rib below in this chondral portion. And when it contracts for inspiration, it's going to pull these ribs up. So this rib moves toward this one, all the way up. So the internal intercostals all course this way. They're not actually behind the ribs. They're between the ribs, but we just put them there to indicate that they're more deep rather than superficial. Okay, so now I've overlaid the black stripes representing the external intercostals. And they are used in inspiration as well, so that they pull the lower rib toward the upper rib all along the chain. And so when your chest needs to be raised or expanded, these muscles are also recruited. So for inspiration, we have the chondral portion of the internal intercostals and the external intercostals, all raising the chest, the rib cage. So in expiration, we have the osseous portion of the internal intercostals, so the red ones under there. They are going to pull in the opposite direction and help compress the rib cage, so to aid in expiration. So that's a case of, we've talked about in some of the lectures, where sometimes the muscle can have an origin and insertion, and it's dependent upon which way the muscles pull and which side of the muscle is stabilized or has antagonist muscles to work against the agonist muscles. So there you have this lattice work of internal and external intercostals, so that you can kind of get a 3D idea of what these muscles look like.